Welcome back to episode 70 of Your Birth Bestie podcast. Today I'm sharing an interview with Dr. Sabrina Thorpe, a mom and baby physical therapist and owner of Foundation Physical Therapy. Today we are going to be talking about C-section recovery, what to expect, and how important physical therapy is during recovery. But also Sabrina shares how physical therapy can help during pregnancy as well, not just after you give birth. At Foundation Physical Therapy, moms and babies build foundational strength and movement patterns to eliminate pain and problems typically associated with motherhood and infancy. And treatment sessions are individualized to each mom and baby to help you feel and move better fast. Hey there, I'm Beth Connors, a midwife and mom of two, but also your birth bestie. In this podcast, we'll dive deep into everything you need to feel confident, prepared, and in control, from baby bump to delivery room, from practical tips to personal stories. We'll cover it all so you know exactly what to expect every step of the way. Let's get into it.
I am Dr. Sabrina Thorpe. I am a physical therapist in the Waukesha area of Southeast Wisconsin, and I am a mom and baby physical therapist. I own Foundation Physical Therapy. I have both a brick and mortar practice and I do some mobile visits as well. So going to see moms and babies.
Well, thank you so much for being here. And I'm so excited to talk about C-section recovery, kind of what to expect, because there's just not enough information around about that. So I would love to hear about your experience, either personally, if you're comfortable sharing, or, professionally, what you've seen about C-section recovery and just in general, I guess.
So I have 3 kids and I've had 2 vaginal births, 1 induction, 1 a natural undisturbed home birth, and then 1 was a C-section. So my C-section was because I had a complete previa, which is where the placenta completely covers cervical opening. So there's really no way for a baby to get out without some catastrophic side effects for both you and baby. So my C-section happened to be scheduled. It was ultimately unwanted, but it was needed, right? So mine was planned. So keeping that in mind, that's very different from emergencies and going through labor and then having a C-section. But either way, C-sections are a challenge.
What would you say? And I mean, you have background as well, obviously, as a physical therapist, what do you see as the most challenging part of that recovery phase that maybe women aren't totally, completely prepared for?
Honestly, it's the little things that we take for granted every day. Being able to get out of a bed, being able to stand up from a chair, walk down the hall to the bathroom, get off the toilet, get in the shower. It's all of those very simple tasks that can become a challenge because of the fact that you have been cut open. Your abs, they aren't cut per se. They don't cut the muscles in the surgery, but it is still disrupted because they have to get through them and pull them to the side to get down to the uterus. And so that, plus not having a baby in there anymore to create some pressure back, really can mess with your stability and your ability to just get from point A to point B. And it's incredibly hard to get out of a bed. Like, you don't realize how strong you have to be to actually move around in the horizontal position. So that's something I think I knew it going in, but actually experiencing it is a totally different ball game.
Yeah.
And yeah, I think if women are not prepared and they haven't learned how to compensate for that can really be blindsiding.
Yeah, it's like once you don't have that ability anymore, you like so much more appreciate when you did.
Yes.
Even now being like 34 weeks pregnant, like healthy pregnancy, it's like, okay, yeah, getting out of bed is challenging. Just like there's nowhere to go. Like there's just certain things that you just don't realize until all of a sudden one day it's shoot.
Exactly.
There's different ways we have to accommodate different movements. So how long was your recovery, I guess, until you started to feel a little bit better even?
Maybe like those first 2 weeks were really, really hard. And then I was able to like go for short walks. I didn't have to use an abdominal binder anymore. I chose to use an abdominal binder because otherwise I wouldn't have moved at all. Then I would say by 6 weeks, because I had been on activity restrictions prior to the C-section, because you will be on activity restrictions after, with like a 10-pound weightlifting restriction and things like that. Your surgeon tells you exactly what those are, but I was chomping at the bit to like get back to things. So I would say at like 6 weeks, I actually felt okay, like 6 to 8. and ready to start doing a little bit more. So kind of on par with like a vaginal birth. It's different though, right? Like they're both
Yeah.
hard and they both take time.
Yeah, it's just more complex when you have that surgical incision and all the other
Yes,
things that come with it with pain management. And if you don't have good pain management, then you can't move. And
correct.
all of those
Yes.
things that come along with just, yeah, having a major surgery that I think people don't always, they're not prepared for because
Right.
C-sections are so common, whether it's elective or emergent, that
Hmm.
we just feel like you're going to bounce back and everything's going to be okay. It's just like any other
Right.
surgery, but it really is a different kind of surgery because you have a newborn and you are postpartum and there's the
Yes.
hormonal shift. There's everything else going
Yes.
on that contributes to the recovery process as well. Yeah, because not everybody has, support after a C-section, or have
Hmm.
to go, back to work in a certain amount of time. And it's just a lot to
Yep.
adjust to.
It really
Um,
is. It really is. And it always kind of boggles the mind. So I have done some therapy like in the hospitals on the hospital floor, right? We call that the acute care setting. And we always, like almost 100% of the time, got referrals from surgeons for any sort of abdominal surgery, especially major ones where like people are open. And yet C-sections, we are not sending physical therapy in the hospital to teach people how to move, um, which I don't know how to fix that. I
yeah,
hear some hospitals in the area are trying, but it's a slow process. And I think it's worth moms being aware of these struggles that you will likely have ahead of time because you can go see a therapist before you even have your C-section, right? You can go when you're
right.
pregnant. You go see a physical therapist and learn the techniques on how to move, and you could bring your partner with you to teach that your partner how to help you as well, because there may be times where you really can't do it with all the techniques in the world. You may still need somebody to help you, and having somebody who knows how to help you can be incredibly beneficial.
Yeah, I think that's important just for people to know that physical therapy in the hospital and before is an option. My husband
Mhm.
works at Pro Health Waukesha Memorial, and they are implementing, that
Yep.
process of seeing moms with, more severe tearing and then also
Yeah.
C-sections. But that doesn't mean that every patient gets that standard. It has to
Right.
sometimes be, advocated for from the patient's perspective too. So, if
Yes.
moms kind of want that care and would benefit from that, then they have to also know that it's available and then speak up. So
Yes. And
there's a
you
lot of
really
those
have to
that,
speak up. Because
yeah.
I asked for a walker after my
Oh my
C-section. I was
goodness.
laughed at. Like,
Oh no.
yeah. So just, and again, that's something, and maybe talking to your OBGYN before you even go in, if you know you're going to have a C-section or you understand that there's the potential to have one, maybe
Mhm.
talking with them ahead of time to see if they're okay with ordering physical therapy, even though it's not the standard, and just be prepared for like the deer in the headlights look
Yeah.
from them. And, um,
I
but
guess, yeah, for any delivery too, really. Like I
yeah,
think pelvic floor physical therapy is important for everybody. That could be
yes,
even like a thing that it should be added to like those initial questions that you ask your provider when you're trying to find
mhm,
somebody and when you're trying to find a place to deliver, are you
absolutely.
supportive of not only like physiologic birth if that's something people are interested in, but also, okay, what does the postpartum look like? Or should I be doing physical therapy before? Or, how to prevent these things and then make that recovery easier because I'm not a
Right.
physical therapist, but I can imagine that if you do work ahead of time, I'm not only preparing, but also physically, that it can make the process
Yes,
easier later on. So,
yes. Prehab is important,
yeah,
and it's really worth its weight in gold. I mean, if we can prevent a problem from happening or start off in a better spot, right? The stronger we are, the more flexible we are, the more connected we are with our body, the easier the recovery is afterward, right? Getting that back is so much smoother because you already had it in the first place versus starting from, let's say, not being able to connect with our pelvic floor, not being able to connect with our core. And now we've done a major surgery or we've had major tearing, and now we also want to try to connect. It's starting from zero versus, starting with like one step ahead. So
yeah. As far as the timeline that people can look at physical therapy after delivery, is there a
mhm,
recommendation? Um, let's say we can be seen in the hospital. Is there like a
mhm.
follow-up schedule that is recommended?
um there really isn't like a true standard. I mean, I think we should be seeing
Mm,
moms in the hospital, and then following up right away. But what the typical recommendation is for like pelvic floor therapy in general is to have a visit maybe like 3 weeks postpartum. A lot of moms like to wait until they're done bleeding, or that kind of they have their checkup with their OB because they think they need the referral from the OB, which if you're in Wisconsin, you don't. So it's kind of up to you. But I think the standard for like across the board is usually around 2 to 3 weeks postpartum, is when women are typically starting. So you've had that time to rest, initial healing, and then we can start to get into things. But there really isn't a reason not to start earlier if you wanted to.
Yeah, there's so much, just hearing from my husband, like there's so much gentle like breath work that can be
Oh
done.
yeah.
Even like as a midwife when I was in the hospital, like there was a few different things that I could suggest on,
Hmm.
my level of, my role in the hospital, but
Yeah.
that initial visit would be helpful in the hospital while they're
Yes.
inpatient, and then kind of giving you those very gentle breathing techniques and different,
Hmm.
pelvic tilt or contract, like different things, to just start
Yeah.
activating the core. I think will get you to those 2 to 3 weeks. And then, okay, once
Yes.
you start to feel a little bit better and your
Yes.
pain is managed and you're a little bit healed, then it's like, okay, we'll still do gentle things, but
Yes.
um,
Yeah.
yeah, I think that's helpful to know.
Yeah. And the other thing too is, and this is vaginal or cesarean birth, if you are moving weird because things are not working properly, that can cause more problems down the line too. So it's not only just, oh, we have to activate it, so we have to activate and we need to look at how we're moving properly. If you're, and we see this a lot like with nursing, right? If we are all kind of hunched over, crunched in, slouching in the chair, you're looking at back pain. I mean, for
Hmm.
months after that, if you
Oh
don't
yeah.
fix it. And if we can start to fix those things right away, and not that there needs to be a lot of pressure, but just some little tidbits and golden nuggets of how to have better posture as you are nursing, as you're walking, even baby wearing. Like a lot of moms use wraps and slings and things, right? Like those things done improperly can be detrimental. So having early eyes on you to teach you and just make sure that things look good can be really valuable.
Yeah, I think that too with like nursing, like if you're going to do that for a long time, it's not just like once a day or once a week. It's like
Right.
12 times per day. And then,
Yes.
and then you're wearing your baby for maybe 6 months. So it's like
Yeah.
something that it just like that compound effect that I remember
Yes.
with my second. I don't remember as much with my first, but with my second, she was nurse. I breastfed her and then I wore her like all the time because I had another one running around. Didn't really
Yep.
have the choice. And it was just like,
Hmm.
I felt myself like declining like slowly, which
Yes.
isn't funny,
Yes.
but like, it's hard to, prioritize that self-care and
Yeah.
that those exercises, but it really is something that I think that also speaks to doing things beforehand because you have those
Yes.
habits in place and,
Yes.
stuff like that is important to then, yeah, make that
Absolutely.
experience a little bit easier.
Mhm.
Yeah, because it's not like you're going to give somebody 1,000 exercises to do and like a whole
Correct.
2 hour a day workout program. Like,
No, no,
it's
no.
realistic when you are a public floor physical therapist and
Yes. Yes.
you have kids of your own and you've experienced this yourself. Like you know it's doable.
Yes, yes. If your therapist is giving you more than like three, maybe four exercises, it's probably too
Yeah.
many and they don't get it. Like,
Yeah. Yeah. Just like,
like we need to prioritize as therapists, and we should be like three, I know is my limit as a mom. Like if I have
mhm.
more than three, it's not getting done. It's just
Yeah.
not.
Yeah, and that's like nice for families to know too that just because, you're signing up for physical therapy, it's just
Mhm.
it's not like you're an athlete. I think that's the only time before I had kids I did
Right.
physical therapy was like due to athletic injuries and you're
Yeah.
doing, all these crazy things. And that's what I
Mhm.
would always compare it to. And I'm like, I don't have time for that, but I feel
No,
like
I know.
it's so much different than that. It's, you're a
It
mom, you're
is.
recovering. The expectations are a little bit different and more doable and
Yes.
gentler. It's not like this, yeah, crazy
Yeah.
workout plan.
No, 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 no. And it's often stuff that you can do with your kids around. I mean,
Mhm.
you might have kids crawling on you, right? If you're doing stuff
Right.
on the floor, but like you can do it sometimes while you're nursing. You can do it throughout your day, right? Just
Hmm.
practicing movements, right? If we're working on squats, you can practice that picking up a laundry basket, picking up your kid, right? It doesn't have to be like a dedicated chunk of time that you have to set aside and find, right? It can just be worked in throughout your day.
Yeah, I love the integration part because we're always multitasking. So
Yes.
just throw in some
Yes.
physical therapy exercises as you're like
Yep.
unloading the dishwasher or something. Like I think
Exactly.
about that sometimes and
Exactly.
like tighten the core.
Yep.
Yeah.
Oh, I do all the time.
Oh my goodness. As far as when mom should maybe seek out physical therapy, let's say they didn't have like a traumatic birth experience in terms of like physically C-section tearing, is there certain symptoms or, things that mom should look out for?
Yeah. So there's lots of things. So it depends on kind of what's going on. So a lot of very common complaints after, we'll just go with like regular, let's just say vaginal birth,
Hmm.
will be just pain, right? Pelvic pain, perineal pain, especially if there was tearing. Okay. That's a sign you need to get evaluated.
Hmm.
If you are leaking urine, so when you cough, sneeze, run, if you're trying to get back to activity, picking up your kids, if you're leaking and don't have full control over when your urine comes out, time to get in to see a therapist. If you're constipated, also time to get in to see a therapist, especially if you've dotted your I's and crossed your T's. You're eating enough fiber, drinking enough water, getting enough like salt, magnesium, like all that kind of stuff, all the things that make the bowels go. If you are still constipated, it's time to go see a PT. And then persistent back or hip pain that really doesn't like respond to stretching, or maybe stretching makes it feel better a little bit, and exercise makes it feel better a little bit, but then it just comes back. So persistent back pain can be actually a pelvic floor issue. And that could be like upper back pain, lower back pain, either one. When it comes to C-section recovery specifically, if you are having like pain in the scar, or the scar just kind of feels weird, it feels really tight, you notice you're starting to get what we call the C-section shelf, where it's like it's bound down and kind of it makes like an indent, you're going to want to go see a therapist. If you are having urgency and frequency of urination. So like you just went to the bathroom and you feel like you got to go again, and it's like that all day, time to get in to see a therapist. And if you have UTI type symptoms, so like you have some burning and some discomfort and it constantly feels like you have to go, and you've been tested, your tests are negative, you've done all the antibiotics and it just keeps coming back, that is often not a UTI. It is a pelvic floor issue. And particularly after C-section, because the scar is usually right around that bladder region, sometimes scars can adhere to the bladder and cause some irritation and give you some of those irritating, I have to pee feelings. And we can do stuff about that. We can release the scars. We can help mobilize the bladder, make sure that the muscles are relaxed and not irritating your urethra, which is the tube through which you pee from. So those are some big signs. Oh, and also I should mention heaviness in the pelvic floor. So like if you're having a sensation of just things are heavy or kind of bulging, those can be kind of early prolapse signs. So we want to be making sure that we are getting in to see a therapist, to make sure we are managing pressure in our abdomen properly. So those
Hmm.
are some of the biggies. I mean, there's tons of other reasons that
Yeah.
you could decide to see a therapist, but I would say those are the big reasons.
Yeah, there's so many other things too that I never like would have thought of that physical therapy could help with. Like
Mhm.
constipation comes to mind. Like people don't normally think of those things. They'd rather just take, maybe a long-term medication to help that.
Right,
It's like there's other
right.
root causes that, alternative therapies can help with, which is just so
Mhm.
interesting. And then especially after a C-section, a lot of times moms don't have the expectations of that they will have still have vaginal bleeding, or they might still have symptoms that they
Oh yeah,
might have associated with a vaginal delivery only. So
right,
having those
right.
expectations to
Yes.
beforehand, and then,
Hmm.
knowing those signs to look for and be like, no, this is due to your C-section, the surgery that you had, the baby that you carried
Hmm.
for 9 months. There's so much that goes on in the body that,
Yeah,
yeah, that it needs to be addressed if these things come up. So,
yeah. And that's probably one of the biggest myths about C-sections in general is that, oh, I had a C-section, my pelvic floor is fine.
yeah.
And nothing could be farther from the truth, because it's not, I mean, not that birth, like a vaginal birth, doesn't, impact the pelvic floor, but pregnancy itself impacts the pelvic floor, because you are putting such a high demand on the pelvic floor to hold up all the extra weight. I mean, they're not big muscles,
Mhm.
they're teeny tiny, and they're holding up all of your organs, plus all the extra amniotic fluid, the weight of the baby, the placenta. that's a lot of extra weight for teeny tiny muscles to hold up. And then your pelvis is shifting and it's trying to hold on for dear life. So just because you have a C-section does not mean you are sparing your vagina.
And even just before people have their babies is just knowing that
Yeah.
that's a possibility and that there's people to help and they don't have to have these symptoms. Like you said, I'm sure you hear all the time about urinary incontinence and people just kind of
Yeah.
thinking that's normal when you have babies. And it's very common, but it's like not something that we had to accept. And that's like, something that I'm passionate about. As just like a midwife. I can
Yes.
imagine like in your field, you're just like, come on.
Yes. Common does not equal normal. Common does
Yeah.
not equal normal. Yeah, so
Yeah.
many things are common and we're told they're normal, but it's never normal to not control when you pee. It is not normal to not control when you poop. Like if you want to poop and you can't, that is you not being able to control when you poop,
Hmm.
right?
Yeah.
Or vice versa. I mean, you can have fecal or stool or poop incontinence too.
Hmm.
Um, so yeah, common does not equal normal. Back pain is not normal. I
Yes.
don't care what they say. Maybe in those first like 2 to 6 weeks postpartum, like, okay, I guess we could call it normal because things are healing. But after that, things should be coming together, like, right? Like
Yeah.
we should be seeing a resolution of those
Right.
signs and symptoms.
Yeah, and just knowing that there is like people out there to help with those things that
Yeah.
do feel like they can, change your whole experience of, childbirth and motherhood and just how you feel day to day, I think hopefully gives
Mhm.
people hope that there is somebody
Yeah.
that out there that help them. Because if
Yes.
you're, constantly having incontinence issues and somebody tells you that's normal, it's like, well, that's gonna be the rest of my life. And I'm like, in my 20s or something,
Right.
or 30s, like that's
Right.
a lot to handle. And like mentally, that's a lot to
Yep.
go through. So
Yep.
yeah,
Yep.
it takes
And
time, but
absolutely. Well, and we're finding too that in like the pelvic rehab space, if you can commit to like 12 weeks of consistently coming in weekly for 12 weeks, you can get pretty much a pretty darn good resolution of leakage symptoms, pelvic pain symptoms. But the big thing is consistency, right? And committing to starting in the first place,
yeah,
right?
totally.
But I mean, that's 3 months. It's not forever. You're
Mhm.
not going to be in therapy forever. You could avoid medication. You could avoid a lengthy surgical recovery down the line, right? Expensive surgical
Mhm.
recovery, surgery and recovery.
Yeah,
So it's finding finding that within you to like commit to it and realize it's not forever.
yeah,
And you could be in a much better place, you know,
yeah,
in just a couple months.
yeah,
So
totally. That's not that
yeah.
long at all. I didn't even like, I think
No,
it would be a long, long time. Um,
no, no. I mean, and that's not to say that everything would be perfect, but usually
right.
by the end of a 12 month, oh my gosh, 12 week, 12 week plan of care. I mean, people's problems are usually pretty well solved if you can stick with it.
Yeah. No, it's awesome to have those kinds of results and just knowing that
Hmm.
like, even if you just see even small improvement, like
Right.
you're going in the right direction. So
Yep.
that
Yep.
helps a lot.
Hmm.
And knowing
Hmm.
that it just would get better from there is,
Right.
very nice to think about.
Yep.
As far as mom's getting back to physical activity, I know you
Hmm.
said like 2 weeks, there's usually like a weight limit, or restriction.
Hmm.
Um, as far as like activity and exercise in that early postpartum period after you have a C-section,
Yep.
is there kind of any advice or things that maybe restrictions people shouldn't think about doing, or what is your
Yeah.
take there? Because, bounce back culture and
I do. I do.
it's all a thing.
Um, well, first and foremost, walking is huge. So that should be one of the first things on your mind is getting back to walking. We need the blood flow. We need to keep moving. We need fluid pumping and moving so everything can heal. So that is a biggie with C-section recovery in those early weeks. The next thing is really working on breath and reconnecting to the core and the pelvic floor, just making sure that everything is working properly. I know right now there's like this big push for like, don't do Kegels and don't do them ever. There's a time and a place for them. And sometimes that time is postpartum, just making sure that you can connect to your pelvic floor and your pelvic floor and your lower abdominals are reflexively connected. So if we are having a hard time just trying to contract the abdominals with breath work, and we can do some forced exhales, we can do shh, shh, shh and ha 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 breaths to try to get the core online. And if it's not, sometimes we have to bring in our pelvic floor to reflexively kick that in. So we are trying to reconnect to the abdominals to make sure that they are firing and starting to give particularly our spine, some support. We also can be working on rib mobility during that time. So when we are pregnant, everything gets shoved up and out to make room for the baby. And so our rib cage also gets shoved out to the side. And sometimes we need a little bit of love to the ribs to get them to come back down. And that can be just very gentle breathing in some postures and with some props that facilitate some expansion through the ribs. So those are the big things that I like to do. And then as the scar is healing, we can also start to work on the scar itself to make sure that that is not binding down. And a lot of women end up with a really thick band across their abdomen of numbness or like weird sensation, whether that's lack of sensation or hyper sensation, like it feels too sensitive. We can start working on desensitizing that scar area so that it feels a little bit more normal. So you do have to look at your scar. You do have to touch it. I know so many women are like, I don't want anything to do with it. And I was that way. I had to have my husband look at it because I was like, it doesn't feel right because it was numb. I mean, I had a band. It was probably like 3 or 4 inches thick, just that was completely numb when I first came home. And I was like, you have to look at it because I'm grossed out. I can't do it. But you will have to get to that point where you look at your scar and start to kind of work with it, right? So that's another thing that we can do in those early weeks, and right after surgery, you let it heal, right? And we work around the scar to mobilize. And then once we've really got a nice scar laid down and everything's healed and closed, then we can start working directly on the scar. So there's lots to be done in the first 6 or so weeks.
Yeah. And I don't know if there's a time frame, I guess, speaking of like the scar, adhesions and things that happen, is there like a time frame when it's, not going to help? If like, is it too late at any point to be?
No.
Yeah. Because I've heard of moms like even like years later,
Yep.
like going to physical therapy or there's doing all sorts, I don't know the exact things that are going on, but that they have all these other options for, getting rid of that scar tissue and people don't even know that's possible. So I think that's really cool.
Yes. So any scar, you can be, it's never too late. I mean, and even just like from like an aesthetic standpoint, like if you have a scar, and this goes again for any deep scarring, like you can use silicone scar sheets on them for healing. There are a lot of scar mobilization techniques. You can use your hands, you can use myofascial cups. I know some people even do dry needling to scars, which I do not do because I don't like needles in the first place. But I mean, it's an option, especially if you are really feeling like I've tried everything and like nothing's working. The scar is super thick, because there are some people who lay down quite a bit of really thick scar tissue, and that's just kind of based on your genetics, how that plays out. But just so you know, it is an option. If you can find someone who does dry needling and is comfortable dry needling scars, it is an option. So.
Yeah, I think it's just helpful for families to know what is out there, the possibilities that they're, sometimes you hear one thing in like a podcast or something, or you see something and you're like, all of a sudden you're like, wait, I need to look that up now. And I need to see if that's something available to me and if that would apply. And you go down the rabbit hole of that. So even just like mentioning things and being more, forward with information for pregnant moms, I think is just so helpful for them to know their options.
Yes, absolutely.
If we could just kind of wrap this up with sharing where listeners can find you, how to connect with you if they're interested in seeking help with you.
Yeah. So I am most active over on Instagram at foundation.pt.wi. I also have a Facebook at Foundation Physical Therapy, and I have a website, foundationptwi.com, if you are local to the Waukesha County area and you wanted to schedule a session.
Thank you so much for tuning in today. I feel like the biggest takeaway for me, not having personal experience recovering from a C-section, but I have helped many moms navigate this experience and have witnessed how challenging this process can be. knowing that there are resources before and after you have your baby to help make delivery easier and prepare you for recovery, and really establish that long-term support to maintain a fully functional body that you can actually feel really good in. There are so many changes that happen to your body in pregnancy, postpartum, and just in motherhood in general, and Sabrina is a really great resource for all of these things. If you are within southeastern Wisconsin and are interested in connecting with Sabrina, please see the show notes for all of those details. Thank you so much again for being here, and I will see you next time. Bye, everyone.